Patient retention is more than just keeping appointments on the calendar. It's essential for building long-term trust and improving care outcomes. When patients stay engaged with your practice, they're more likely to follow treatment plans, manage chronic conditions effectively, and experience better health overall. Today, we'll explore innovative strategies for your practice that you can use to improve retention without adding stress to your workflow. Dr. Henderson stood at the center of her busy family medicine practice with one mission: to turn everyday patient interactions into lasting relationships. Frustrated with rising no-show rates and inconsistent feedback, she gathered her team and asked a simple question: what does true patient engagement look like? It started with culture. Dr. Henderson empowered her staff to see themselves as patient care champions, as key influencers of patient satisfaction. Every morning began with a brief huddle where the team reflected on patient flow, communication lapses, and small wins. They reimagined how they greeted and guided patients, starting with warm welcomes, personal introductions, setting expectations clearly, and always explaining the why behind every step of care. Each interaction ended with a sincere expression of gratitude. These weren't just procedural tweaks. They became habits of connection, grounded in empathy, clarity, and authentic presence. Her staff was coached, not just trained. Mentors emerged within the team, guiding new employees in both technical workflows and the soft skills of connection. Making eye contact, responding calmly to stress, and reading nonverbal cues. Between visits, the transformation continued. Dr. Henderson implemented text and portal communication for follow-ups and prescription checks. Her team sent curated newsletters, celebrated patients' birthdays, and applauded milestones in chronic care management. They even piloted remote patient monitoring for those with diabetes and hypertension, ensuring that care never stopped at the clinic door. She also leaned into shared decision-making. During appointments, Dr. Henderson slowed down to explain treatment options in plain language and asked, "Does this make sense for your life?" Patients felt seen, heard, and involved. Their satisfaction scores climbed, and so did compliance and retention. Within 6 months, missed appointments dropped 20%. Survey cards handed out at checkout consistently scored 4s and 5s. Dr. Henderson's practice didn't just retain patients, it became a beacon of community-centered care. The difference? A team that saw engagement as not a task, but a shared purpose. When these strategies work together, retention becomes less about reminders and more about relationships. Patients return because they trust your care. They feel supported in their journey and health, and see your practice as an essential partner in their well-being. Reach out to RCMA for support, resources, and tools tailored to your practice's needs. Thank you.